Okay, this is an MSK session. So we have child 10 years female child Sarah. Okay, she has some
Okay,
joint pain. Examine her.
okay, sir. I'm entering the room. This is Dr. Srikanth, one of the child specialists today. Uh, I want to examine you, Sarah. Is it okay with that?
Yeah, yes, doctor.
So I will do my hand wash, and I want to look at from bed end. Is there any distress?
No distress,
No dysmorphic features?
no dysmorphisms,
Any devices around room?
no devices. She is wearing glasses.
Okay. Dimensions?
She is moderately built, 8
Uh,
meter average.
Sarah, I want to ask few questions. Is it okay?
Yeah,
So, do you have any pain or uh, difficult in your joints or muscles?
uh, yes, doctor. I have some pain while dressing.
Okay. Do you have any difficulty going up and downstairs?
No, doctor.
Okay. Uh, so, I want to examine her. Mm, is she dressed up, or I want to expose her hands?
Yeah, she has rolled up till elbow and uh, till her knees. Tell me what you're looking for. I will tell you the findings if it is there.
Okay. I'm looking for any rashes, skin rashes.
Looking for skin rash. Okay,
Yes,
you
sir.
get this sort of
Okay.
patches at the
Uh,
knee.
okay. Uh, I want to examine her nails also.
Okay.
Any
Okay,
abnormal?
nails are normal.
Okay. I want to examine muscles, bone,
Which
joints also.
muscle, which muscle, which bone, which joint.
Uh, uh, lower limbs, lower limb joints.
You want to examine the lower limb joint.
Yes.
Okay, there is no obvious thing in the lower limb
Okay. Any
apart from the
other?
skin lesions.
Okay. Okay. I want to do a head to toe examination. Uh,
Okay,
I want to expose her back and नहीं करो केदारनाथ. Okay.
kindly others, please mute yourself.
Okay. Uh,
Yeah,
I want to examine her gait.
okay. Her gait is okay.
Okay. Walk. Is she able to walk on heel
Yeah, she's able to walk on
uh,
heels.
on tiptoes?
Yeah, she's able to walk.
Okay. I want to examine her knee joint.
Okay, you want to proceed from knee joint. Okay, knee joint is normal. There is no obvious deformity there.
Okay. I
Okay,
want
note this
to
picture. Apart from the
examine
skin, there
her.
is nothing there.
Okay. Can you
Hmm.
hold your hands out straight in front of you?
Yeah, yes, she is able to hold. She
Okay.
is holding it.
Can you make a fist?
She is able to make a fist, but she has some discomfort there.
Okay. Uh, if you feel any discomfort at any point, let me know. I will straight away stop examination.
Yeah, thank you,
Particular.
doctor. Thank you.
Uh, okay. Can you pinch your index finger with the thumb? Uh, uh,
She is able to do, but there is some pain there.
okay. Touch the tips of your fingers in each hand. Can you touch?
Again, she feels some pain in the thumb IP, both the hands.
Okay. I want to squeeze her metacarpal phalangeal
She
joint.
feels pain. She feels pain. So the examiner tells to avoid doing further.
Okay. Okay. Uh, Can you put your hands together, palm to palm? Is she able to do prayer sign?
Yeah, she's able to do that.
Anti-prayer sign?
Yeah, she's able to do that.
Uh, can you raise your hands to the ceiling as you try to touch the sky?
Yeah,
Is
she's
she,
able to do that.
okay. Can you look at ceiling?
Yeah, she's able to look.
Can you is she able to touch the chest with the chin?
Yeah, she's able to do that.
Uh, uh, Please, can you put your hands behind your neck?
Yeah,
Is she
she's
able
able to put, but some pain is there at the hands or at the neck.
Okay. Uh, uh, is she able to touch the shoulder with the ear on both
Yeah,
sides?
she's able to. She's able to.
So I want to put my
Okay,
fingers
time is
in.
6 minutes over.
Okay.
So,
So
what would you like to do in order to complete your examinations?
yes, sir. I want to examine her knee joint, uh, hip joint, like internal rotation and
Okay,
flexion. And I want
okay,
to ask her to bend forward to touch her
okay,
feet.
okay. You want to do the peak also the lower limb and spine. Okay,
Yes, sir. Uh, in order to complete my examination, I want to examine her eyes also. Mm.
okay,
Okay. Can I go for discussion, sir?
okay. So, what is your differentials?
Uh, uh, one of my differential is um, she's joint pains and rash, a silvery color white rash over the back, and
Okay,
rash over knee joint also. Maybe uh, psoriatic arthritis, juvenile idiopathic arthritis.
okay. Any other differentials you would like to offer?
Mhm.
Okay. So, how would you like to
Juvenile
investigate this child?
juvenile dermatomyositis.
Okay. So, how would you like to investigate this child?
So I want to send first of all a full blood picture to look for any anemia or infection signs. Uh, I would like to send inflammatory markers like CRP and ESR,
Mhm.
and I would like to send anti-nuclear antibodies also,
Okay. For what purpose?
and to look for any antibodies or any specific antibodies,
Okay.
like to rule out
Okay.
autoimmune diseases.
Okay. How would you like to manage this child?
I will involve my multidisciplinary team. It consists of
Okay.
pediatrician, general physician, and rheumatologist, dermatologist also. Mm, I would like to reduce her pain first by giving analgesics.
Okay.
Based on my diagnosis, I will prescribe analgesics, steroids, and
Okay.
yes, I will offer physiotherapy and occupational therapy also.
Okay. So, any bedside test you would like to do for this child? Maybe if this child is on steroids, can you tell me some bedside tests you would like to do?
Uh, Eye examination, sir.
Okay. Time up. Okay, but still will continue.
Glucose, GRBS, glucose, blood glucose.
Okay. Okay.
BP also. I
So,
want to measure BP.
okay. Okay. Fine. So, what advice would you like to give to this child and parents?
Mm. Regular follow. I will ask them to follow up regularly and progress. I want to see progression of the disease and response to the treatment and any side effects of the medication. I will educate the parents about the disease and my treatment plan.
Okay. Okay, fine. So now it is open for discussion. We'll stop here. So let me tell you first tell your feedback, like how we can improve from here. Like, what do you think?
I thought I'm unable to start properly which system I want to examine. I forgot like PIGALs or PRAMs.
Okay.
So I have that confusion while presenting case.
Okay.
Because of that anxiety, unable to diagnose properly.
Yeah, it comes to all of us. Yeah, that's fine. Okay, any others feedback here? It's open for discussion. Others can interact. Hello.
It was not done in a proper sequence. Like in the beginning, he was told that this child has problems in dressing. So, and he has no problems in climbing up and down the stairs. That's a pointer towards the fact that probably the child doesn't have a problem in his lower limbs, but he should start with the examination of the upper limb and the back.
Upper limbs, back, yeah. So this problem with the dressing shows that there is some problem with the upper limbs or the spine. So that is pointed towards where you should focus. Yes, point taken. Okay, any others would like to give the comments? Okay.
Another doubt I had, sir. Like when he said that he has pain while with the small muscle movements of the small muscle, should one go ahead with all the maneuvers like checking for the tenderness of the metacarpophalangeal joints? That is quite a painful thing if the child is already in pain. So I needed more clarity on that.
Generally, if the child is on pain, once you start doing this MCP squeeze test, be gentle while doing it, okay? The examiners will generally stop you. Okay. Yeah, the child is having pain, doctor, be gentle. If that's the scenario, then we stop there, okay? The finding is taken. You have elicited the finding of MCP squeeze test, which shows that the MCPs are having some arthritis. So generally, we don't proceed further and elicit more pain. You can obviously compare to the opposite limb, the other hand also. Once again, if there is pain there, it is taken for granted. So you will get more marks by ensuring comfort rather than eliciting findings from there on. Generally, the examiner will stop you from that point. Okay.
Yes.
Okay. So my suggestion to improve this approach further is, first thing is you ask the question initially itself. It is better to ask the question initially itself rather than after the middle. Anyway, if you have forgotten, if you have started examining, then don't be too much of thinking and go proceed further. You can stop and ask question. Sorry, is it okay if I could ask some questions to you or to the mother? Okay. In that way, you ask the questions. Do not be like if you forgot also, no issues, but ask the questions. Okay. Once if there is a pain in buttoning or unbuttoning, then you localize the problem to the upper limb and then or the spine. So you proceed with the PCALs of the upper limb. So that is the first inference we take from that point. Okay. And if you get to see, I want to have this picture because majority of the dark skin children will have some sort of picture like this, where they have already undergone some topical treatment also. So you may not get the typical ciliary patch what you're seeing here.
Okay, sir.
So some skin finding is there on the external source, strongly think of psoriasis. If it is hyperkeratotic, strongly think. If there are scales, it is confirmed.
Is this the erythrodermic type or the guttate type of psoriasis, this rash?
Erythrodermic is generally diffuse, like it will have, this is more of a guttate type, like drops.
Guttate
Okay.
is more common in children, right, sir?
Yeah. After this infection, streptococcal infection, generally. But otherwise also you can have a combination of these things. That is not an issue. We do not pick up the types of psoriasis. Those are not required for us. Just if we pick up the skin finding, it is hyperkeratotic and it is, notice the scaling is there. I will to think in terms of psoriasis, then you have got it. That's all.
So the bedside test that you asked was pertaining to psoriasis or pertaining to steroid toxicity?
I asked a question as pertaining to steroids. If the child is on steroids, what are the bedside tests? And he correctly told about blood pressure and capillary blood glucose. So those were the points I was expecting.
Sir, what
Okay.
about the
So
nails? There was no finding. Did you show the
yeah,
nails
yeah,
of
yeah.
the patient?
Yeah. I told there is no findings, but I have some pictures for you. Okay.
Okay.
So once you are done with the 4Ds, the distress, dysmorphism, devices always look for any splints in and around, okay, any wheelchair and any specs. Those will say child has had uveitis. Then your dimensions apart from that, after that you expose the child, get the permission. If the child is wearing this full hand or full pants, it is by purpose meant for you, okay, whether you are rolling it up or not. Because after the candidate goes out, the examiner will particularly make the child to dress fully, just to check that whether you are rolling it up or not. So get the permission and roll up to the elbows and the knees. So do a full head to foot approach, looking for examination of your skin, hairs, nails, obvious muscle asymmetry or muscle atrophy, then obvious swelling, any bone or a joint swelling on either sides. Look for asymmetry. Okay. So that is the first step you are going to do. After the screening questions, here you are going to roll up the dress and do full examination, just a glance from head to foot for skin, hair, nails, muscle, bones and joints. Just looking whether there is any gross deformities there or not. At this point, if you don't find anything, then you are going to just lift the shirt up with the permission and look at the back. If there is scoliosis, ask the child to bend. And when the child is getting up, you are going to look for a few things like Goa sign there. The child has difficulty getting up. Okay. Whether the scoliosis is disappearing or not. Those things you are going to observe at that point. Okay. And if the child is able to keep the foot, the hand like this below when bending down, you think he is having hypermobility, then you are going to go for the Beighton score. So at this point, your approach will vary. If you have find something local swelling is there, then you are going to go for the PREMS. Okay. If you are going to get a Gower sign, then it becomes more of an myopathy and dermatomyositis sort of thing. If you find the child is keeping the hand below, it means that he is in hypermobility, then you go for the Beighton score testing.
So that should be done when the gait is examined, right? On the standing position, when the patient to stand. That is the time when we can go for the Beighton scoring at the same time.
I would suggest to say after the initial general examination, you are exposing the child, looking for the skin, hairs and nails and any obvious muscle or bone asymmetry there. If you are not able to localize anything, then look at the back. Then ask the child to bend and lift up. Thereby, you will also think of myopathy. And if he is just able to keep when your beanie is bending, if he is able to touch the floor, then think of hypermobility. Then at that point, you will start for HMS, Beighton scoring, after the gait. But you will focus your examination to the hypermobility part. Is it okay? So by at the end of your gait, like you should be sure what you are going to proceed. You're going to proceed for a generalized pregals, or you're going to proceed for any local examination, or you're going to test for hypermobility, or where you're going, or for the proximal muscle testing if it is a myositis. Just kindly mute your mic. Hello.
Sir, if child is having pain, should we go for regional examination? Only
If the
pain.
child is having pain and obvious swelling, you are going to go for regional examination.
Okay.
If there is only pain, no swelling, go to the pegals of that part, then localize it where the pain is.
Sir, I
Okay.
did not understand what. So could you repeat what you said?
See, if the child has a pain and swelling after you are looking at head to foot, okay, at that point you will go for the regional examination of the joint, PREMS. Okay, look, feel, and move approach for the joint. Then you can do P-GALS of the that part of the limb. Okay, by the time your time will be over, you will say, in order to complete, I will do P-GALS of the other limb. Say, for example, when you are exposing, you find a knee swelling, okay, or you find an ankle swelling. You will do the look, feel, move approach for that joint. Then you will do P-GALS of the lower limb. By the time your time will be generally over, you will say, in order to complete, I will do P-GALS of the upper limb. Okay. Now, in the question, when you're asking the screening question, the child says that he has pain while climbing stairs, but you're not able to find any obvious deformity, any swelling anywhere in the lower limb on your head to foot examination, then you are left with no other option to go for the P-GALS of the lower limb first. Okay.
Sir, I have a question. What about
Yeah.
general physical? Like, do we have to see anemia, pallor, palm, lymph nodes in this examination of musculoskeletal?
Generally, you will not have time for that. I would say just pull out the hands like this. Okay. You will pull out the hands like this and look for the findings in the hands. Say, for example, you may get a rash there in the hands, or you may get a nail finding there. You may look for the palmar vasculitis if it is an SLE or a myositis. You may look for the cotton papules. You may look also for the pallor. If there is an obvious pallor, comment upon it, then go to the face. I always say go look at the hands, then go to the head to foot approach. If you think anemia is there, then ask the child to do like this. Okay. Check for the anemia part. If you are very obvious, if it is very obvious. Otherwise, like, do not waste examination for pallor, ictus, and other things. Is that clear?
Yes, sir. Thank you.
Yeah. So regarding the, you are able to see the skin patch, and you are telling this differential as juvenile arthritis, idiopathic arthritis, psoriatic type. You can all tell that other rashes like this could be dermatomyositis. Yes, still possible. Okay. Investigation, generally after your when the time is over, you will tell, in order to complete my examination, few things. One is always tell about the vitals, okay, including your capillary blood glucose and BP if it is an arthritis case, because they may be on steroids. So always tell about the vitals. Centiles, including the limb length. If there is an obvious asymmetry there in the limb length, always tell that I will measure the limb length. Centiles, including the limb length, as well as if it's an adolescent, Tanner staging. Then the third point, in order to complete, is always tell about which, if you have examined the P-GALS of the upper limb, in order to complete, I will do P-GALS of the lower limb, and I will do a full examination of the skin, hair, and nails. Okay. Then a formal eye examination, if it is an arthritis case. Is that clear?
Yes,
So
sir.
there are some
Sir,
4
can
or
you
5
please
things
repeat
you will
it?
tell. Pardon?
Kindly repeat it.
Okay. For all MSK cases, it is vitals always. Okay. For any case, for that matter. And if the child is arthritis, I think he'll be on steroids. So tell vitals, including capillary blood glucose and BP. Then always centiles. Okay. Weight and height centiles. I like to plot them in a chart. And if it's an adolescent, include Tanner staging. If it is an arthritis, if there is a limb length discrepancy, you see in the general examination, you find some of the limb is short. You always say that I have to measure the limb length also. We will not have time to measure the limb length, practically speaking. And if you are done with the P-GALS of the upper limb, as for this case, you will tell that I like to do P-GALS of the lower limb in order to complete my examination. Then you will tell about 2 systems. One is examination of skin, hair, and nails, a complete examination, as well as a formal eye examination for this case, particularly if it is an arthritis, juvenile idiopathic arthritis.
Abdominal examination, sir.
If you think it is systemic JAA, or if you think it is other cause of an arthritis, say for example a malignancy, if it is a monoarticular, then you will bring in all those things. If you find a scoliosis, you will say respiratory system. If you think we'll go to that. Maybe if you think the child is hypermobility, morphinoid, you will tell about, I will also examine the cardiovascular system. So I'm telling for this case, for a case of
Okay.
juvenile epileptic arthritis, these are the things to complete.
Okay.
Investigations always divided into two parts. One is investigations pertaining to this case. You will do an acute phase reactants like an CRP, ESR, and those things. Okay. And ANA in juvenile epileptic arthritis is meant for eye, not for the other purpose.
Okay.
Okay. ANA positive children are at risk of uveitis. So for that purpose, you will do ANA. And if it is psoriatic arthritis, then you may say the child has a back pain, like difficulty in dressing. Then that could be because of spine issues also. So you can do HLA-B27, okay, for the sacroiliitis part. Then baseline investigations, you can tell blood counts, viral markers, renal function, liver function. You can always bring it at the next set of your investigations. So for the pertaining to your case, for the diagnosis part as well as for the baseline part. Management part, it is medical part, medical for the joints. It should be like NSAIDs, then DMARDs like methotrexate, okay. Then biologicals after liaising with my pediatric consultant as well as the rheumatology, okay. Then for the skin part, liaise with the dermatologist, think of topical therapies for the psoriasis. Then the non-medical part. For that, think of physiotherapy. If it is an acute joint pain is there, then you will think of RICE, okay. Rest, ice, compression, and elevation, okay. That's just like in hemophilia. If it is a chronic, then you will think of physiotherapy, like start slowly, okay. Gentle exercises to improve the range of function and to prevent contractures. Then if the child, like this child has some pain in the hand joints, okay, you will involve the occupational therapist so that she has some like her writing skills and everything is not taken care, it is not disturbed, it is taken care of. So that is the way. Then you will say you would supportive therapy like liaise with the school, okay, maybe giving more time or other non-writing way of making her to read, like use of personal computer like that. Maybe orthotics, okay. So, and then follow-up support, vaccination. You can bring in all those things. And advice for any arthritis case, there are a few points. One is like you will, if it is an acute joint, you will tell about RICE. And if it is like a chronic case, then you will tell about gentle exercises to prevent this deformity. Then counsel, as you are telling rightly, counsel for long-term follow-up, counsel about the chronicity. If the patient is on steroids, then giving a steroid card or a bracelet. Advice about vaccination, avoiding live vaccination, and avoiding infection because this child will be on immunosuppression. So avoiding overgrading, avoiding infection. That's how we go for it. Okay. Is that clear?
Yes, sir.
So for arthritis, like you have some fixed points, like what you will tell, because in order to complete, you will include certain things and advice. Because generally the questions will be like, how are you going to investigate, how are you going to manage, then what advice you are going to do. These three will be standard questions. Usually by this time, the time is already over. Okay, there is hardly any time left for more specific questions. Generally, they don't ask about drugs and other things and all. If you tell DMARDs and methotrexate, then it's all over. Okay, in general.
What advice
Is it
to
okay?
parents you said?
Advice first is rest. If it is an acute joint flare is there, it is rest and rise. Okay. Then gentle exercise if it is a chronic case to prevent deformity. Then counsel the parents for regarding the chronicity, advice about long-term follow-up, advice about steroids, cards, or having bracelets because child is on immunosuppression, avoid overcrowding, avoid getting infections. Okay, vaccination advice, need to be regular with the flu vaccines and other pneumococcal vaccine, avoiding this live vaccination. So then counsel them for long-term follow-up. Clear?
Yes,
Okay. So the nail findings for this case, just leave it. I told that there is no nail finding. If it is psoriasis, the one is the nail dystrophy. Okay, it could be a fang dystrophy like the one you are seeing on the left. It could be a dystrophy like subungual hyperkeratosis like the one you are seeing on the right side. And the center one is the nail pitting is there. Okay. Sometimes these may not be very obvious, particularly if it is we are in high stress inside that hall. Nail pitting and all may not be obvious. So nail dystrophy will be there. Just ensure that you are just seeing and looking at the nails. If you are giving a running commentary, you can always tell if it's an arthritic case, I want to look at the nails, look for any nail psoriasis. The examiner will be more than happy for that. Okay. And skin findings, this examination of hair, like they will have this dandruff-like thing on the hair, okay? And generally on the extensor surface, psoriasis is seen on the extensors, so the knees and behind the elbows. So I wanted to look head to foot from front as well as sides as well as behind. And they may have this set of, if they are on treatment, you may not see the typical hyperkeratotic patch. They're like the one on the right side. It may not have the typical hyperkeratotic things while they are on some topical treatment. Okay, so case 2, somebody has volunteered.
Yes, sir.
Okay. So now we have this examiner. So we have this 4-year male child, maybe. So examine her lower limbs.
Okay. Sir,
Your time starts.
okay.
Yeah.
I'll enter the room. I'll wash my hands.
Mhm.
I'll greet Mary. Mary, how are you?
Yeah. Yeah, she's smiling at you.
Okay.
For 15 minutes.
Others, kindly mute yourselves.
Okay, Mary. I'm one of the doctors here. I've come here to examine your legs. Is it okay? Is it okay for you?
Yeah, yes. Her mother says yes. Yeah, okay.
Okay. I'll see whether she is in any distress. Is she in any distress?
Not in distress.
Okay. I look at the surroundings for any devices. Are there any devices?
No devices.
Then I'll later on I'll take her height and weight and plot on growth centiles. I look for any dysmorphic features. Are there any
No
dysmorphic features?
dysmorphisms. No dysmorphism. She's moderately built.
Mary, are you having pain anywhere in the body?
Yeah, she has this pain while climbing stairs and walking.
Okay. Are you able to dress and undress yourself?
Yeah, she's able to help me. The mother says she's able to help the mother while buttoning. She is able to do it.
Okay. After that, I'll ask Mary to roll up her pants up to the knee. Okay.
Yes.
Okay. So I can see that Mary is having swelling over the left knee joint. Okay, and so I'll do PGLs of the lower limb. I'll ask Mary to lie down, and she's having swelling. So I'll do regional examination. Sorry, I'll do regional examination of the left lower limb. She is having swelling of the left lower limb. Is it red? Is the skin over the swelling red?
It is not red.
Okay, then I will I'll ask permission and I'll touch over the swelling. Is there any warmth? Or
it is not warm.
I'll gently press over the swelling. Is there any tenderness?
Like where you are expecting tenderness at what point?
Over the knee joint?
There is some joint tenderness is there at left knee.
Okay. After that, I'll ask Mary to flex and extend the left knee joint. Is she able to flex and extend the joint?
She is not able to do. She is able to do it partially, but then she has pain.
Okay. After that, I'll do examination of the left ankle joint. Is she able to do a dorsiflexion and extension?
Yeah, she is able to do the dorsiflexion and plantarflexion. Yes.
Okay. Inversion and eversion.
Yeah, she is able to do.
Okay. Then I'll check for the left hip joint also. I'll ask Mary to do flexion and extension of the left knee joint, left hip joint. Is she able to do?
Yeah, she is able to do, but her movement is limited because she is not able to bend at the left knee.
Okay. What about internal rotation and external rotation of the left hip
Like
joint?
she is saying it is painful at the knee when you are trying to do that.
Okay. I'll do the examination of the I'll do examination of the right lower limb also.
Okay. Which part you want to examine?
Hip joint, knee joint, and ankle joint. Right.
Okay. She is able to move the movements, hip flexion, knee flexion,
Okay.
extension, dorsiflexion, and
Okay.
plantar flexion. Anything else you want to do?
Okay. I will. Okay, sir. Okay, sir. I'll.
Okay, what would you like to do in order to complete your examination?
In order to complete my
Kindly
examination, I will. I would like to examine the upper limb joints also. For
Okay.
any swelling, any pain, any tenderness.
Okay.
I would also like to examine the lymph nodes and abdomen for any hepatosplenomegaly.
Okay.
Yes, sir. I would also like to take the
Okay.
I would also like to take the vitals,
Okay.
vital parameters, height, weight,
Mhm.
and proton growth chart.
Okay. So what are the differentials?
So my differential would be a 4-year-old child with oligoarthritis. My differential would be septic arthritis,
Okay.
oligoarticular JIA, any infectious causes like TB,
Okay.
osteomyelitis, septic arthritis, malignancy.
Okay. So how would you like to investigate this child?
Investigations, sir, basic investigations, I will do CBC, CRP, blood culture, peripheral smear, X-ray of the left knee joint, ultrasound of the left knee joint. If the fluid is if there is a effusion, I would like to do a tapping also.
Okay.
Aspiration.
Okay.
And
So how would you like to manage this child?
management wise, AB, it would be a multidisciplinary team comprising of pediatrician.
Okay. Considering this case as a case of an juvenile idiopathic arthritis, oligoarthritis subtype, how would you like to manage this child?
So my team will include pediatrician, rheumatologist, orthopedician, physiotherapist, occupational therapist, and for treatment wise, I would be providing NSAIDs, ibuprofen. Second line treatment would be localized steroid injections. Then non-medical treatment like gentle physiotherapy, hydrotherapy, and splints.
Okay. So, what advice would you like to give for this child?
Advice would be avoid avoid infections, regular vaccination, flu vaccine. Look for steroid toxicity. And
Okay, time
this
is
one,
up.
sir,
Okay.
of the eye examination, sir.
Okay, finally you tried and die. Okay, time is up.
Yes, sir. Yes, sir.
Okay.
Eye
Okay, then.
examination. Most important.
Okay. Yeah. Okay, so it's open for discussion. It's a quick discussion here. How we could improve here further. And so you can comment upon like how you can improve this. Now you're not on the time stress.
So, sir, actually, after the local examination of the left knee joint, I did one joint above the swelling and one joint below the swelling. And after that, what should I do, sir? Should I?
The better way is when you are, see, MSK always, as I told you in the introduction class, like always compare it to the opposite side. Sometimes the swelling may be very subtle. Say, for example, the photo you are seeing, the left knee is looking, the parapatellar fossa, everything looking like full in the left knee. Okay. In the right knee, the parapatellar fossa is quite normal, looking normal as it is. So sometimes the swelling may be very subtle. So always compare with the opposite side. If you are going for the examination of the left knee, then simultaneously look at the right knee also. It is very easy to do it simultaneously. Like looking for the swelling or the skin, where is the swelling, muscle above and below, joint above and below, just look. Okay. Then look for the warmth using your dorsum of your hand. Then look for the any tenderness is there, any joint tenderness is there. Then whether the swelling is whether it is a bony swelling or whether it is synovial swelling. Okay. A duffy swelling, synovial swelling. If it is synovial and a fluid-like swelling, then it is more of an effusion is there. Then you will go for special test. Say, for example, a patellar tap.
Yes, sir.
Okay. So you're looking for effusion. Patellar tap or the cross fluctuation. Patellar tap is more easy to do. Okay. Once again, compare the same, the palpation, the field, the findings in the other limb also. So you're going to look both the sides, feel both the sides, then move both the sides. Because this movement approach, we are not going to measure any angles. There is no time for any of those things. Okay, we are going to just compare the movement with the opposite limb. The examiner will be more than happy if you're able to elicit the finding that this limb is moving short or this limb movement is restricted compared to the opposite limb. That finding you're able to pick it up, then you are done there. Okay. So always compare with the opposite limb. Then you can do one joint above and below approach, just inspection and movement. Okay. Then the P-galls of the entire lower limb. Usually by this time, the time is over. If you still have time, do the P-galls of the upper limb also.
So you said after regional examination, we should do P-galls the lower limb also.
Yeah.
Okay.
Okay.
Did you, sir,
then-
did you mean that just leave the affected joint and go for the unaffected joint on the other leg, isn't it? Do the
That you're
examination.
going, you're going to compare both the sides, both the knees initially for the look, feel, move approach.
Since this is an,
Okay.
there is a very obvious swelling, do we have to look for, this effusion and capitals and all that in the affected joint? If there is obvious swelling, because it will be a
Obvious swelling.
painful thing.
Generally, if it is an juvenile arthritis, it will not be that much painful. It is more of a chronic problem. Okay. If it is tenderness is there, if the skin is red, it is more of a septic arthritis. Usually, you will not have those cases in exams. The child will be toxic. The other thing is, it could be a hemophiliac joint, hemophiliac arthritis. In that scenario, also, it will be very painful. Hemophiliac joint is very painful. So, usually, they won't keep these cases in exams. If it is painful, very painful, acute red knee, then generally by palpation itself, like you will not go further. You will not do the tapping and you will not do patellar tap and other things, cross fluctuation. If it's a chronic condition like JA, then you are expected to do the patellar tap to ensure that you are looking for actually swelling with the fluid inside. It's not something else. Okay. Does that answer your
So it's
question?
okay to go for patellar top and other exercises for this swollen knee, isn't it?
Patellar tap in the left knee. Okay.
Pardon, sir? Left knee?
Patellar tap in the left knee only, not in the right knee. Right knee, there is no swelling. Got it?
Yes, sir.
Do patellar tap only when there is a swelling. In whichever knee there is swelling, you are going to do patellar tap. If it is you are suspecting a fluid there. If it is a bony swelling by palpation, then you are not going to do patellar tap there. Okay. Clear?
Yes, sir.
Okay.
Do you also check for the ACL and PCL, all of that tests as part of the examination?
No. We never have time for those things. Instability, generally, we don't go to that level. But if you ask me whether the examination of knee includes those things, it includes. Examination of knee is a bigger topic. We can't finish in 6 minutes. And generally, instability and other things like soft tissue meniscal tear, those tests are not warranted at our level. Okay. They don't keep a ACL tear for your MSK session. Okay. Now see, after finishing your initial dysmorphism, distress, and other things in the general examination, always look at the full examination of the skin, hair, and nails. Okay, do a full roll up and always look at the skin for any other finding. As I told you initially itself, if it is an arthritis MSK session, the examination findings are directed towards two things. One is to find the cause of the MSK problem. Other one is, if it is an arthritis, then to look for any steroid-induced toxicity. So whether you are picking it up, any of the findings of steroid-induced toxicity will carry definitely 1 marks. So remember to look for the other findings in skins. So that's why I told you, after you are finishing the 4 Ds, do a roll up everything. Okay. Then look at the back. Just pull the shirt up, look at the back, get the permission, look at the back. Mostly if you look at the back, you will get some findings. And the most important investigation in a juvenile rheumatoid arthritis, if it is a monoarticular thing, then it should be ANA. Okay, because that is going to tell you the risk of uveitis there in a case of an JAA. So ANA is done to if ANA positive children, particularly less than 5 years children, females less than 5 years, those are high risk factors for uveitis. Then you could always do the acute phase response, peripheral smear, full blood count, and supportive investigations, those things. Management, as you mentioned, it is for the joint, for the eye. Okay. So you would liaise with the ophthalmologist for the management of this uveitis part. And the team, as I mentioned, everything, include the ophthalmology also in the team. Okay. Advice include the ophthalmology follow-up here. If it is a single joint problem, your differentials, if it is a hard joint, it should be septic or hemophiliac. Okay. Or post-traumatic. If it is not hot, not a warm joint, then it should be juvenile idiopathic arthritis. Rarely, it could be a malignancy, something like that. Okay, or infective cause like a tuberculosis or maybe Lyme's in abroad other ways. Lyme's is uncommon in Indian scenario. Is it okay? So shall we go to the next? So anybody is willing for the next case?
I can try.
Okay. So your time starts now. May I know your name, doctor?
Yeah, I'm Dr. Tanushree.
Okay. Okay, so you have you enter inside the room. You have 5 years male child John. Okay, I'm examiner. I'm saying this is an MSK station.
Okay, I enter the room, sanitize myself, take permission, and ask the 3 questions, screening questions. Does the child have any pain in any of his joints?
No joint pain.
Okay, does he have problems with dressing and undressing? And
No
climbing?
problems in dressing and undressing, and no problems in using stairs.
No problem in climbing up and down the stairs. Okay.
Yeah.
How does he look? Is he ill or well?
He is comfortable.
Is he okay? And what about his build? Is he normally built?
He's somewhat thin built, but normal stature.
Okay. And what about his weight and height?
Yes, as I told, he is more thin built, and height is looking average.
And what about weight? You said, sir?
He is thin built.
Thin build.
Weight you can
Okay.
measure the end.
And
You want to measure.
any dysmorphism?
No dysmorphisms.
Okay. Straight away, is there any devices around him?
No devices.
Okay. Straight away, I go start with the maneuvers. First, I try to examine him standing. I'd like to take a look around if he has any scars, any limb length discrepancy, any
No
shortening.
scars.
He
No
has
scars.
scars.
No shortening.
Okay.
Pardon?
Any atrophy of the muscles?
No atrophy of the muscles.
Okay, and I asked him to walk as he normally does. Is there any limp?
No limp.
Okay, and can he walk with his heels?
Yeah, he is able to walk the heels.
Can he walk with his tiptoes?
Yeah.
Okay, I asked him to, I examine his back at the same time and look for any scoliosis, kyphosis. Is there anything present in the back?
No scoliosis, no
Okay,
kyphosis.
can he bend down and touch the ground?
Yeah, he is able to bend down and touch the floor. He is able to keep the entire hand on the floor.
Okay, I would like to see for the other signs. Is he able to touch his thumb with the flexor aspect of his elbow?
He is not able to do that thing. Thumb, you are not able to do.
What about the little finger? Is he able to touch it beyond 90
Little
degrees?
finger, it is coming only up to this level, as you are seeing in the picture.
Okay, and that the other maneuvers. Oh, what about his carry candle in the elbow? Okay, that looks normal. Okay, then next
There is some hyperextension. Okay.
there is some hyperextension. Okay. So the score seems to be more than 4. After that, I would like to.
Did you check the knee hyperextension?
Is there knee hyperextension also? Yes, there is knee hyperextension. The score seems to be more than 4, so his hypermobility score, Baton score seems to be more than 4. So he has some hypermobility syndrome.
So what is the score?
Score would be 5.
Okay.
And next, I would like to go for the sternal sign. Does he in his upper limb does the thumb cross extend beyond the palm when it's flexed?
No.
Okay, and I would look for arachnodactyly if it is present in this child.
Pardon? What are you looking at? Come again?
Arachnodactyly if it's present in this child.
No. No.
Okay. And if I encircle the thumb with one hand, does it cross the little finger? Can it, the wrist sign?
Are you doing it, or you are asking the patient to do it?
I'm trying to. Is my video visible, sir?
Yeah. Please.
Yeah, I was just trying to show, like, if you encircle the thumb, encircle the wrist of the person, does it overlap? Just as in.
No, it doesn't overlap.
Okay. And regarding the upper limb, the maneuvers quickly. Does he have pain anywhere while he stretches out his hands?
No pain.
No pain. Okay.
MCT
And
squeeze is negative.
okay. Other on squeezing the joints.
Yes,
Is
time
there
is
any
up.
pain?
Time is up. Okay, what would you like to do in order to complete your examination?
In order to complete my examination, I would like to do a full pig health examination of this of the upper limb as well as the lower limb and the back as well, and then examine the cardiovascular system of this child, the skin, and I would also like to measure the vitals, the blood pressure, the weight and height.
Okay.
And
So how would you like to investigate this child?
since this child shows hypermobility syndrome, I would like to check, do an examination of the eyes, look for any subluxation if it's present. Then I would also like to go for looking for check the urine to look for presence of
Okay. So how would you like to manage this child? Considering this as a case of hypermobility, how would you like to manage this child?
Yeah, I would like to have a multidisciplinary approach. Would like to involve my consultant, the pediatrician, the rheumatologist, cardiologist in case the child has some cardiac manifestations. Since my differential diagnosis would include Marfan's as well as Ehlers-Danlos syndrome, I would also like to involve the physiotherapist, then the occupational therapist, and this is the multidisciplinary team. And then since it's
What is the role of occupational therapist here?
Occupational therapist will improve will make modifications if at all required at home, or if he has if need arises. The physiotherapist will improve the muscle strength, improve the mobility.
Okay, time is up. We'll continue. Okay, yeah, please continue.
Mobility.
Okay, what advice would you like to give for this child?
Pardon, sir?
What advice would you like to give for this child?
No idea, sir.
Okay, no issues. Okay. So you see, yeah, okay. Okay, we'll come here. Okay. like you ask the screening questions, you would look for the like, okay, you will just get your comments first. Okay, let me know like how we can improve it further. What do you think?
This is my
She
first
did.
time, so I was a little confused.
Okay, you did well. Okay, yes. Others feedback?
She did the other examinations, not concentrate
Yeah.
on MSK.
Yeah. She did the Peyton score. She did the PGALs of the.
Yes, she didn't do the Bigal. She did the Python score and the maneuver.
Yeah. Okay. So see, once you finish your screening questions, then your general examination, then you are exposing the child head to foot, having a gross view. Okay. Also look at the head. See, in MSK station, you will look at the hands and the head and the foot definitely and the back. Okay. Do not forget to miss these areas. You may get findings here and there. For example, if it is an psoriasis, you may get some patches on the hands, or like if it is dermatomyositis, say patches on the hands. Lupus can patches on the vasculitis, rashes on the palms. Similarly, the head is important. For example, if it is an osteogenesis imperfecta, you will get some blue sclera there. Orphans, you look for lens dislocation. Obviously, not an by visible eye, but you will do eye examination. You will look for spectacles, something like that. A cleft palate or a palatal, high arched palate in Marfan's, palatal ulcer in lupus. So hand and head is important, okay? And foot, for foot arches. If it is hypermobility, you will look at the foot arch, okay? You will, while standing itself, you look at the attitude of the limbs. And overall, if you're asking child to bend, then you look at the back, no scoliosis, ask the child to bend and get up, whether any Goa sign is there, whether he's able to touch the floor. So you will segregate where you are going. If he's able to touch the floor, it becomes a hypermobility thing, then you'll go for the Baton's maneuver directly. So if we are going to hypermobility thing, if the child is an average stature, then think of Ehlers-Danlos sort of thing. So you will do all these things, Garlin sign and skin elasticity, in addition to your Baton score. If the child is tall, looking morphinoid to you, then you go for the screening of the Marfan's part, like looking for the high astral palate, looking for the ensuring that there is no scoliosis. Once again, look at the chest for any pectus deformities. Just have a quick auscultation of the CVS. That's how you do. Okay, your approach should be either way, depending upon the child is normal stature or tall. Here, as I told, the child is an average build, so not an morphinoid. So your diagnosis will more towards picture in terms of an hypermobility. Probably a differential should be in Ehlers-Danlos syndrome. Investigations, it is more of a genetic investigations. You may do an echo screening, cardiologize the cardiology. And the definitive management will be like more often physiotherapy here, low impact exercise like special shoes. If there is arches are there, not there, then special shoes, low impact exercise like swimming, cycling, screening the family members, involving liaising with the clinical geneticists, and maybe use of an orthotist or a physiotherapy, occupational therapist for home modifications. That's how it goes. Okay. I just want to put this picture in case you want to know like what is the role of an what we can do for hypermobility. We use these kind of aids so that they have the grip. The picture on the left shows how an EDS will have difficulty in holding a pen. So what you can do is you can increase the diameter of the grip by adding some more things to the grip, or you will put something like one over the index finger. So by which you will strengthen the grip. So these are special orthotics, and occupational therapist orthotists will be able to guide for the Ehlers-Danlos. And advice for the Ehlers-Danlos part, first important advice is avoid doing the repetitive activities. So if they are able to bend the joint, they should be advised not to do it again and again, because that is going to stretch and that is going to damage the joint more. Okay, so avoid doing those repetitive activities just because they can do it. They should not do it often. And I'd always advise them a low impact exercise like a swimming or a running sort of thing. And avoid obesity, like avoid getting overweight. So counsel them they should not put overweight. And supportive shoes if they require. If the arches is not there, then special pencils, have special pens, and follow up education. then screening of the family members. That's how the advice goes. Okay, so have these 4 or 5 points for hypermobility. You'll be able to tell something for the time of 3 minutes. Okay. Any doubts here?
Like after getting to know that this child has hypermobility, will the course of the examination shift completely for them, or do we actually carry on with the PGALs of the lower limbs?
I would say you do the weight and score first. Demonstrate
Weight and
whether
score?
it is hypermobility is there or not completely. And then you can go for the PGALs if case time is there. Okay.
But PGALs of the lower limbs or upper limbs, or what in this case?
Entire. If you have time.
Entire, okay. Whatever time.
Entire. If it is a tall stature, then be very opportunistic and look for the morphoid features. Okay.
Okay. Okay.
So in others and MSK station, you should be very opportunistic. You should do like whatever finding you pick it at, then you should change your route. So you always have some checkpoints at where you are going to change your direction. As I told, the initial part with the screening question is that will give you a clue. Then you expose the child, look at the back, ask the child to bend, look at head to foot, look at skin and hair and nails, then you get a clue. If there is a localized swelling, you go for PREMS. Hypermobility, go for weight and score. Okay. If your go sign is positive, think it could be an inflammatory myositis, sort of muscle power and testing and so on and so forth.
This child had all the screening questions negative. He had no.
Negative, yeah.
Yeah.
They generally do not have that much of pain. Okay. Only if they do repetitive activities, they may get some vague pain. Otherwise, they don't have that active arthritis sort of pain in hypermobility. They don't have the swelling also. Okay.
Okay, okay, sir.
Case 4, somebody wants to do it? We'll do quickly. Anybody want to volunteer, or we'll go to the...
I can do.
Yeah, okay. Is
The
it the recording
recording
has
is on.
stopped? I think recording is going on. I think it's on. Am I right?
Yes, sir. Yes, sir.
Okay. So who wants to volunteer here?
Can I try?
Yeah, kindly introduce yourself, doctor.
Yeah, I'm Rupal.
Yeah. Okay, Dr. Rupal. Okay. So, like as you are entering the exam, I'm just introducing the case. You have 3 years male child Sam. He has difficulty in walking.
Okay, so I will wash my hand and I will introduce. Hello, Sam. I'm Dr. Rupal, one of the doctors here. So today I want to examine you. Is that okay with you?
Yeah, Sam is just looking at you. Mother says, yeah, it's okay.
Okay. So, do you have any pain anywhere in your body, Sam?
Sam is not answering. Mother says he has some vague pains here and there.
Okay. And do Sam have any difficulty in walking upstairs, downstairs?
Yeah, overall he has pain, and sometimes he walks and sometimes he doesn't. So there's a vague pain there.
Oh, okay. And do Sam have difficulty in dressing, undressing as well?
The mother says that she is only doing it. I'm only doing it, doctor.
Oh, okay, all right. So I will look in the surrounding. Is there any devices? I will check shoes for any special shoes.
No devices.
Okay. I will look at the child's growth, height, weight, head circumference, and dysmorphic features.
No dysmorphism. He looks short for his age.
Okay, so it is like a disproportionate or proportionate short stature, obvious.
It looks somewhat disproportionate. You may measure it if you want, in case at the end.
Okay, so I will ask Sam, could you able to walk?
He will be able to, somewhat slowly.
Slow walking.
Yeah.
Okay, so on observation, I can see there is a double malleolus and wrist widening. There is no chest deformities. So I will ask him to walk on tiptoe and then on heel.
He is not listening to you. He's not that much cooperative also. He just walks a few steps and then come back to his mother's lap.
Okay, so I will look at the back for any deformities. Oscar.
No back deformity. Like what okay, no back deformities.
Okay, so I will start a Pigel examination if he is cooperative.
Okay.
So I will ask him to straighten both arms, and I will see for any limb length discrepancies.
Like you are planning to measure it or what?
So I will first ask him to straight the arms like this way. Can you see?
Okay. Yeah, he is able to do it. Both the limbs are grossly like same.
Okay. So I will then ask him to stretch the arm, outstretch the arm like a star.
Yeah, he's able to follow you. He's doing it.
Okay, so I will ask him to do opposition of the fingers.
He does it partially.
Okay, then I will I will ask mom if there is any pain in the hands
No pain.
or how he is responding. I will see by palpating all the fingers and look for the face for any tenderness in the
MCP
joints of the
squeeze test is
hand.
negative. MCP squeeze test is negative.
Okay, so I will then ask him to do a prayer and reverse prayer sign.
He is able to do it, but not very fully.
So restriction of the wrist joint.
Yeah.
Okay, so I will then ask him to look up and straight arms on the ceiling.
He's partially doing it. He's not very cooperative.
Okay.
He has some difficulty in raising his hand also.
Okay, so I will ask him to do to put both arms on the head.
He is following you.
Okay, no restrictions.
No restrictions there.
Then I will ask him to put both the arms behind at the back.
He's following you.
Okay. Then I will ask him to put 3 fingers in the mouth and open the mouth.
No, he is not following you.
Okay, so I
Okay,
will
time is
look.
up.
So I would like to complete my examination by performing the wrist joint examination, local joint examination, and the elbow examination, and the lower limb pigel examination.
Okay. So what are the differentials?
So my differentials here, if there is no sign of inflammation on the wrist joint, then there could be a case of rickets because there is a frontal bossing, wrist widening, ankle and bow legs is also there, and he is short for his age. But I would like to plot him on appropriate centile chart, and I would like to see the growth and the bone profile.
Okay. How would you like to investigate this child?
I would like to perform the wrist X-ray left wrist X-ray and see for the signs of the rickets like cupping, fraying, splaying. And I would like to do serum calcium phosphate ALP, serum PTH, and my renal function test and liver function test, and full blood count to look for the anemia. And child is also having abdomen distension, so I would also like to do celiac screening.
Okay. So how would you like to manage this child?
So considering this child is having rickets, I will provide the vitamin D and calcium supplementation. If it is a celiac screening, celiac, then I will go for a gluten-free diet after confirmation of the diagnosis, after
Okay.
consulting
Considering
the
this child as
specialist.
a primary case of rickets,
Mhm.
how would you like to manage this child?
So I will give a massive dose of vitamin D, 60,000 IU weekly for 6 weeks, and I will again perform the serum level of vitamin D and calcium phosphate supplementation.
Okay.
If it is vitamin D deficiency rickets.
Okay, doctor. Thank you. Time is up. Okay. So now tell me like how it went and how we can improve it for this station. What is your opinion first?
I think I should first check for the local joint of the wrist joint and ankle joint.
Yeah. So when you have an obvious finding, please do the local examination first before you can do PGALs.
Mhm.
Agreed, MSK you have to do PGALs, but if you have a local examination, you have a local finding there, so do a local examination, PREMS, and before going for the PGALs. Okay. So that you should do. So you came at the last. You're going to complete it. You're told like you want to examine the wrist and other things. You have an obvious wrist swelling like this. You want to know whether the swelling is a synovial swelling or it's a bony swelling. The swelling is at the level of wrist joint or above the wrist joint. Okay. So you say it is a bony swelling, then there is on inspection you find there's a swelling around the wrist and both sides. Skin is normal. There is no redness. Okay. Then on palpation you see it is not warm. There is no significant tenderness. Okay. The swelling is a bony swelling there. Then it shows that it is a widening of the ends of the bones. Okay. So maybe then you can do the PGALs of the upper limb and similar swelling, similar bony swelling. If it can be very opportunistic, you can look at the similar swelling at the knees as well as at the ankle. You can directly go to the palpation part there. And if you want, you can complete the PGALs. Okay.
Yeah.
So if you think it's vitamin deficiency, also look for myopathy. Okay. So that is one thing. So when you're doing PGALs, the child is not able to lift his hands above his overhead abduction is not possible. Think it could be a proximal myopathy also. So as you're asking the child to bend up, like looking at the back and asking the child to bend down and bend up, once again, you can look for the myopathy signs there. Look for the buttock wasting, look for any secondary causes of vitamin D deficiency.
Yeah.
In order to complete, you will do centiles, you will do examination of the tone power. You would like to do check up the BP also, because this could be a renal rickets also. So look at the check at the BP also. Then look at the gastrointestinal system examination. So that is how you complete the examination. Okay. Is
Yeah.
it fine?
Yeah. Thank you.
Investigation, you will do the bone profile, calcium, phosphorus, as you mentioned, vitamin D, hormone, alkaline phosphatase, X-ray. You mentioned the findings rightly.
ABG, sir.
Which one?
ABG. Blood
Yeah,
gas.
you can do. You are looking for an acidosis. You can do resistant rickets. Yes. So if you are going to the second level investigations, always tell you would liaise. Okay, you don't decide on those things. You would tell to liaise with the team. Management part, specific management is vitamin D. Then look for any secondary causes of vitamin deficiency, which could be because of an GI cause or a renal cause or a liver cause, anywhere. Then you start with the vitamin D regime. If there's no response, think of an vitamin D dependent rickets. So if you get a finding like this, what is your impression?
Is
What is
VDD
this?
are type 2?
So this is dependent rickets type 2. Okay, you have alopecia and some enamel defects. Okay.
Some kind of ectodermal dysplasia?
No, this is vitamin D dependent rickets type 2.
Type 2.
Okay, they had dentition issues and alopecia. And in the team, we are telling always in the management, bring the team. Okay, so here you can bring the community pediatrician, maybe endocrinology, maybe dietitian here. Dietitian is very important, right? If you are thinking of an vitamin D dietary cause of an rickets. So then orthotist maybe for appliances. In physio, that you can go on. Now, so this is your, so we will solve the cases here, okay? Just want to give a quick recap. See, you are going to hand over your sheets, wash your hands, wish to the examiners, then introduce yourself to the mother, get the consent. I'm going to examine your child's joints and make the child move. Is it okay? Then always start with the, if you are doing the epigals, remember that you are going to do the 4 general examination, 4 Ds, then expose the child, okay? Look for the examination of skin, hair, nails, muscle, and bone. Anything abnormal there, go to that point. Nothing abnormal, you are going to look at the head as well as at the foot. Anything morphinoid there, how is the foot arch, okay? Anything abnormal, go to that point. Nothing is picked up at this point, expose the back. Look for scoliosis as a child to bend down. Look for any signs of any myopathy there, or the child is able to keep the hand flat on the floor. Then at that point, go towards localize the effort to hypermobility or to the examination of the myositis proximal myopathy. Then nothing is picked up there, go for the gait. Okay. So then still nothing is picked up, go for the P-Gulls. So this is how we are going to go. If you are going to localize somewhere, then always compare the opposite side. Look for the muscle and joint above and below. Look for the skin above. And always palpate for the warmth using your dorsum of your hand, tenderness. Then any special test is required. Whether it is a bony swelling or it's a synovial swelling. And then always move the joint. Always do the active movement first, then passive movement. Okay. Compare it to the opposite limb. Hypermobility, I think people are aware. So this is what I was trying to tell. Like if you have a joint pain with the swelling, with or without swelling, with or without deformity, and with or without restriction of movements, it should be arthritis. Okay. If you have a joint pain with swelling and without any deformity or any restriction of movements, it should be an arthritis. So the differentials could be generalized arthritis, commonly kept in exams. If it's in a single joint and acute, very hard joint, think of an septic, hemophiliac, or a post-traumatic arthritis, generally avoided in exams. Always in the differential, you can keep it like an rheumatic and leukemia down the line. Okay. If there is a skin involvement, think of an psoriatic arthritis, JI subtype, or it could be a childhood lupus, or it could be an general dermatomyositis. So you're going to look at the hand as well as at the face and the back. So you're going to roll up till elbows and knees, look for all these skin findings. And if there is a swelling and deformity alone, then it should be rickets. It could be with or without short stature. If the child is short, then you can attempt doing short stature approach also. If there is no pain, no swelling, anywhere, nothing is there, then think of hypermobility. If it's a normal stature, think of EDS. If it is tall, look for morphinoid features, then be opportunistic, look for other findings of morphins. None of them are fitting it up. You have an multiple, like some scoliosis there, something very dysmorphic is there. Think of a syndromic child. So for example, in an MPS, it can be kept in an MSK station. Or it could be a short stature approach also. Okay. So that's how the MSK station goes. So have this thing. So have the 3 screening questions first. That will give you an idea. Then examine, expose the child, get permission and expose, examine for skin, hair, nails, muscle, bone and joint. Any obvious deformity, then go for the PRMs there. Okay. If you don't find anything, then look at the head to foot, including the arch, including the attitude, limb length. So anything is there, locally is there. If it is not exposed the back and as a child to bend, look for scoliosis, look for Gower sign. If the child is able to touch the floor, then you'll be able to say whether it is hypermobility or not. Nothing is there, then go for the gait. Then always do examination thinking of 2 things. One is for the findings as well as for the stereotoxicity if it is an arthritis case. Then depending upon up to this level, whatever you have, you will do PRMs or HMS. If no finding picked up, then go for PGALs. Okay. Then always remember you will not be able to finish completely in 6 minutes. In order to complete, you will tell whatever things you want to do. So any questions from here? Be happy to take. We have not touched upon the Marfan's part and the deformity part, the arthritis with the deformity part, and we have not touched about the scoliosis part and spine examination, other things.
So
Okay, any doubts?
for hypermobility, what investigations are to be done?
If it is a short, if it is a normal stature, you are thinking EDS, it is more of an genetic workup and maybe cardiovascular workup. That's all.
What?
Okay. Genetic and cardiovascular. Okay. There can be a vascular EDS and you always look for this echo and other things. Okay. If it is a tall stature, then think of morphinoid. So you will do eye workup and cardiac workup. And if there is scoliosis, then you will look for the restricted lung disease, pulmonary hypertension. You will look for scoliosis correction, orthopedic involvement. You will look for the Cobb's angle and everything. So the management will go on those lines. And in order to complete, you will also involve the screening of the other family members, physiotherapy, management part, physiotherapy, occupational therapies, screening of the family members, genetic screening, liaise with the clinical genetist, and so on. Is that okay?
Yes.
Yeah, and the advice part we have discussed. What advice will go to hypermobility? Okay. Any further doubts, or we will close it?
Thank you, sir.
Okay. Okay. Thank you all. Good night. Happy
Thank you.
reading.
Thank you.